again, Thursdays with Dr. Lillian, and today I'm going to talk about a very important skin type, which is sensitive skin, because not a lot of people know that they have sensitive skin. They just complain. So how is sensitive skin or how does it happen? Usually these people are kind of have a base of an eczematous prone skin. So they have a layer of fat that's supposed to be on the top layer of the skin that's not available in them, which is available in normal people. So this makes it very easy for allergens to come from the environment into the skin and cause irritation. So it's easy for it to enter through the skin. The other way of also having sensitive skin is sometimes some people overuse chemical products and products with, for instance, like hydroxy acid, salicylic acid, that kind of deprives the upper layer of the skin from this protective fat layer, and also again causes all the irritants from the environment to be able to go into the skin and cause irritation. They usually complain that they have red skin and they have irritated skin, and the feeling of anything that comes on their skin might cause them a burning sensation or the feeling of uncomfort. So how to take care of this kind of skin? Usually the main thing in these patients is that they need to look for products that says on it for sensitive skin and that says on it hypo-allergic, hypo-allergenic, and that does not have chemicals such as preservatives, perfumes, or coloring. So anything that has color, that means they cannot use it, and anything that has a very strong smell, they should try to avoid it. And there are specific type of skincare products out there that says hypoallergic, hypoallergenic, and for sensitive skin, and this is what they need to look for. So regarding cleansers, they have to avoid using any cleansers that says alpha hydroxy acid on it or has any sort of acid ingredient that might cause them to be more irritated. The other thing is that these kind of patients do not tolerate vitamin C products or retinol products because this can be too irritating for them. The cleansers have to be in the form of lotions or milk cleansers and more cleansing, moisturizing cleansers because this helps them to soothe the skin. Also, there are specific creams or lotion for sensitive skin that has calming agents in them, such as Aloe Vera and Chamomile. And sometimes also just using certain type of moisturizer, such as glycerin, also helps to make them feel less sensitive. The other thing, I like to avoid toners in these patients, to be honest, but there are certain micellar solution cleansers made for sensitive skin that have calming agent with the new products that are coming out, which I still like and I still use with my patients, and I had good results. So what can we do for them in the clinic that can help them? There are specific type of facials that we do for patients, and this is for sensitive skin. So they can actually have a deep cleansing session that does clean all the debris from their skin and does a deep cleansing, but then when the beautician uses products that are calming to the skin and that do not irritate the skin. So this is very important for them to emphasize on the beautician, the certified beautician, when she handles their skin. The other thing is that not to overdo the facial. So in these patients, we try to avoid for them not to do them on like a frequent basis. So they should probably only do the facials once a month, and this would be more than enough for them. Now, the other thing that there is available in clinics for these patients is the treatment that is called HydraFacial. HydraFacial is one of my favorite treatments for these patients because it hydrates the skin, it infuses serums into it. I try to always tell the beautician to avoid using any kind of acids on them when they do these sessions, and mostly concentrate on just hydrating them and infusing the active serums into their skin. Now, there are other things that we can also do. It's mesotherapy. I like injecting mesotherapy ingredients with hyaluronic acid. This kind of hydrates the skin, pulls in the water to the molecules when it's ingested underneath the skin, and gives a very plumping effect to the skin. Like I said, anything that these patients have to use has to avoid using anything with color. So I do kind of tell these patients to avoid using things such as gels that are colored or scented, because this just will irritate the skin even more. The key word is hypoallergic, hypoallergenic. So this is basically it, just sensitive skin in a nutshell. I hope this was beneficial for you. Don't forget to subscribe and and like this video if you do like it. And then follow us on all the other social media platforms. Bye!